is already observed. So today, as you see in my background, I know a lot of you may have been watching the news and seeing that we have a measles outbreak over here in the US, and I'm sure it's going around other countries and we may not hear about it. So we're going to touch on that a little bit today. I'm going to try to do it in one segment. If not, we'll split it up in two. So let's talk about what is measles. I'm not going to be showing the PowerPoints because I want you guys to probably try to listen to me a little bit more. Next week, I'll probably show you pictures. So measles, which is also known as 10-day measles or red measles, is an illness that is caused by a virus. It is an airborne disease, which means it spreads throughout the air when an infected person breathes, coughs, sneezes, or even talks, or even you touching on a surface that this person may actually touch on. People with measles are highly, highly contagious. About 4 days before they develop a rash until about 4 days after the rash starts. So what are some of the risk factors and how is this spread? Now, I already talked about a little of that, as you can see in the initial start of my presentation. So the risk factors are unvaccinated individuals. And I know there's controversial discussion about vaccinations, but it has been proven that unvaccinated individuals are at high risk. If you are older than 20 or younger than 5, pregnant people are at high risk. And if you have a weakened immune system, how it's spread, being around someone again with the measles, including talking, sharing food with them or drinks, kissing, shaking hands, hugging, touching on surfaces or object containing the virus, and then touching your mouth, nose, or eyes. There's also what's called vertical transmission from a pregnant woman to the fetus or baby during pregnancy, delivery, or while even breastfeeding. So what are some of the symptoms of measles? Measles symptoms include a high fever. The person usually have a barky cough, red or bloodshot eyes, runny nose, tiredness, red spots with white centers in your mouth, rash, digestive symptoms like diarrhea, stomach pain, and vomiting, sore throats, muscle pains, and headaches. Symptoms don't appear all at once. A fever, cough, runny nose, and red eye may appear first. Then the spot that I spoke about in your mouth, which is called acoplic spots, might appear 2 or 3 days later and fade when the rash begins. The rash appears 3 to 5 days after your initial symptoms start. A high fever may develop with the rash. So how does doctors diagnose this? A healthcare provider might be able to diagnose measles based on your health history, a physical exam, and the appearance of the rash. To confirm diagnosis, they might use blood tests, swabs from your nose or throat, or even urine test. So let's say someone gets measles. What can they expect? Measles cause severe illness. About 2 out of 5 people with measles are typically hospitalized. Even after the individual have recovered, they might be more likely to get sick with other infections. This is because measles often destroys the immune system cells, responsible for remembering past infections that you developed immunity to. So, sometimes, especially those of us that are adults, whenever we start working, they may start doing what's called titers. And the titer tell them if you have an immunity to mumps, measles, rubella, different viruses. So this is what this is explaining to you. You can also develop life-threatening complications months or years after having measles, especially if you have a weakened immune system. So what are some of the complications of measles? Well, complications of measles can be mild to life-threatening. As you've seen, and if you're here in the US that are watching, we've had several people with children that have died because they're unvaccinated and developed measles. So ear infections, dehydration from severe diarrhea, bronchitis, laryngitis, pneumonia, blindness. People can have brain swelling, which is called encephalitis, People can also have a rare but fatal nervous system infection that happens years after measles infection, and that's called subacute sclerosing panencephalitis. I'm not going to go through all that with you. Sorry about the medical terms. Measles inclusion body encephalitis. So brain inflammation that can happen most often in people with compromised immune system, days to years after having measles. And of course, unfortunately, death can happen. If someone had measles while pregnant, the baby could be born early preterm or have low birth weight. So I'm actually going to stop at that part of the presentation because next week, I know there's some myths about measles versus chickenpox when you see these rashes. So we're going to go into that more next week. Thank you so much for your time. God bless you and enjoy the rest of the service.